Morning, today is May 5th, 2026. Present with us right now is the County Health Nurse Supervisor, Pam Hanna. And here, so you want to lead us off on what things are in your department, Pam, please?
Okay, thank you. Well, we released our patient that I talked to you about last month from isolation. We'll still be providing care for the patient for about 6 months. So we're still actively involved in helping the patient, helping them to get better. They also have household contacts that we will be doing some work with for about 3 or 4 months. So like I said, this is a complicated communicable disease case, and it is still taking quite a bit of time and energy for us. The good news is the patient is recovering and is doing better. So that's the good news. We have had a decrease in COVID and flu. So I think we're getting to the end of that season, which makes us feel happy. We have had an increase in sexually transmitted infections, however, including gonorrhea, which typically we don't see too much of, but we've had chlamydia, gonorrhea, and syphilis in the last month, so that we've been taking care of. So that's something we're kind of keeping an eye on because it isn't also a typical thing that we're seeing very often.
How much of a percentage are you seeing in the increase?
You know, I haven't figured that out, but we've had 1 gonorrhea case and 2 syphilis cases. One of them turned out to be not a syphilis case, but we still had to do the investigation. But we've had 3 or 4 chlamydias in the last month, which is a pretty significant increase. Generally, we see some increase in sexually transmitted infections in May as school gets out, graduations happen. We also see some around the time of the fair. So generally, we look at seeing some around May, August, or September, but usually they're not quite this early. So we've been kind of watching that. Let's see. I know we had a conversation last week through email about the dental equipment, and we decided we would talk about that here. So I'm just wondering kind of where we're at. I did in my email just asked a few clarifying questions like, is this being donated and what is it exactly? I think that accepting that without really knowing what our building expansion is going to look like might not be the best option. I'm not sure that we have a provider that would come in here, if they would be here every week, or how many days a week. And so occupying space that's very specific might not be the top of our priority. So my question is there a dental provider like Sacre's office in Whitehall that might want or need that equipment now rather than storing it? So those were kind of the things I brought up in my email, and I don't know what your thoughts are on that. I haven't seen what equipment is there.
I haven't clarified with him what he's got, but I think he took it out of the office down there by L&B. So it's probably.
Did that office sell or?
I think it did sell. I think it did, yeah. But so whatever it takes to run a dental setup, I have no idea. But
so I mean, it tends to not be the best idea to store equipment like that. It doesn't age well when it's stored. So that's my input on that. Equipment that.
And I think the logistics of it are going to be tough anyway, because typically dental equipment has to do with plumbing and everything else that you're going to have to probably have water and sewer, everything available right there, where a regular office doesn't. I think it's going to be a pretty heavy lift to get something put in somewhere in that building for that. And then again, providers, he actually said that him and his friend, the 2 dentists that live in town, there shouldn't be any reason we couldn't do a day a week, but that's not guaranteed either.
I heard it was going to be donated, but I think it would be stored for
Yeah.
quite some time.
Yeah, I mean, we're not really in a position to know exactly what we have space for in the building yet. I have been looking at the plan a little bit. And, you know, the needs are a little different than what they were when we initially, you know, had this plan looked at. And if the county does purchase the building, it gives us different options too, because we have access to the whole building and not just. So I know that the medical providers have reached out to me and said, will we be involved in any of the planning for this? And I said, absolutely. You know, we want to make sure your needs are met too. We're not wanting this to be just a one-sided thing. We want your input. And then the other thing that is different in looking at the building now is that we really need to home environmental health with us because we're providing service there. And we had an issue last week when Molly was gone where the contractor came, needed into the Paradise building. I didn't have a key to it, didn't know where the key was. So I said, Molly, we've just got to have keys here because evidently she had the key at home. So we have to be able to have access to that building when the contractor needs in there. So if we could get everything into our building, that would be a priority for me right now. So I'm thinking that what we had dedicated originally as maybe conference room space might end up being environmental space instead. And we might have to look at the other side for, you know, if we can put conference room space on the north side in that piece that's in the front, maybe even moving out with that a little bit. And then the other thing that happened while Molly was gone is we had related to environmental health is I had a resident come who was looking for some information and he was agitated because he'd been to the treasurer's office building. There was still a sign over the thing that says sanitary. I know there's a sign on the door that says where to go, but there's still that. So he'd gone downstairs, couldn't find anybody. Then he saw the sign still on the Paradise building, went there. Eventually he found us, but he was agitated because he has no idea where to go. So I don't know if those signs can be taken down on the outside of those buildings so that people aren't going there. And I know we've put out some information from our end on the health department side saying that in the absence of the sanitarian, you know, we're providing these services, but I don't know, you know, that people are getting the message. And some of them, you know, have that brain work of I go here because that's where I've been before.
Right.
So
that might be something, I need to go look at the sign and see what's on the door, because I mean, people that went downstairs at some point will probably return there without looking to see that it moved.
well, there's that little metal sign above the stairwell that says sanitarian. So I think we need to take that off the wall.
Yep. And
And
if they
then-
make it down there, then there should be a sign that says this is no longer the sanitary.
Well, and there is a sign on the door
Mhm.
before you even go in, but whether people actually look at the door when they're opening it, I don't know.
Right.
It's pink, I think, because
It's pink.
it should stand out. But
I'll take
anyway,
a look at it. Yeah, I appreciate you letting us know.
Yeah.
I didn't hear of any problems, so.
yeah, well, that's what came in our door. And then Jim Murphy provided a little bit of an update in our staff meeting this morning on the junk vehicles. So also in the environmental health category, the Clancy ones, there's some progress being made. They've removed several of those vehicles already.
Yep.
And he's continuing to work with that owner their goal is to try to get and reduce as much as possible by Clancy days, which is June 13th. So it sounds like they're making progress there. I guess there's another junk vehicle issue out in Whitehall. And he said he had sent a note to Mr. Haddon asking for some legal guidance on that one that he hasn't heard back on. So it sounds like he's been working on both of those complaints and making some progress, but maybe needs Steve to respond back on the Whitehall one, so.
So far, Jim's doing a really great job.
Exceptional.
Yeah, yeah. And then I guess with the Clancy situation, the same complainant for the house that we're working with is now complaining about the store. And so that one,
That one will be next. Jim
Yeah.
said we're gonna work on one thing at a time. We're
Yeah.
not gonna-
yeah,
So, which is good.
so.
And I think the guy understands that. I mean, he's made more progress with that mess than anyone has in decades. So.
Yeah, well, Jim's good.
He is good because the church has been asking him.
Yeah.
I don't know, Megan and I got rid of all of them at one point.
Did you?
Yep,
Oh, nice.
and they're all back.
Oh, right.
Rules change.
Things multiply sometimes. And then I did get, an email about, from Mr. Hatton this week that I was very pleased about, with the regional for opioid, abatement funds. And I do have some ideas for that. Haven't totally hashed that all out, but really both those local funds and that regional funds are a great way for us to support what we're already doing with mental health and prevention. There are 14 things we can use that funding for, and prevention is targeted as one of those things. So a couple of the ideas that I'm kind of throwing around that don't have real substance yet, but one of the things that Erin, our school nurse, has mentioned is that they're struggling to keep the signs of suicide funding in the schools. So that would be a great place to put some of that funding so that we can keep those programs we're already doing and fund those. So I asked her to do some checking on that for me so that we had some actual information about what we would, how much and which schools and timeframes, those kinds of things. So that might be a place we can do it. There's another program called Hope Squad where you use funding to support peer mentoring with middle school age kids for suicide prevention, which I asked her about in the past. That might be something that we look at if the schools are also open to that. It aligns very well. In fact, I think it's the companion to QPR, Question, Persuade, Refer, which is the other suicide prevention that we teach here in the county. So if we could buddy the Hope Squad with what we're already doing, those are the things that I'm thinking about on the school level. But then another idea that a friend of mine, a colleague of mine and I talked about is that, and it's actually Park County who's doing this, who is
Just gonna say.
Morton, who sent this original one. So his health officer and I were talking about it the other day, and they're looking at a model where for crisis that they allocate 2 hours a week to the mental health providers, the local ones, that they pay them whether they respond or not. But then when there is a crisis, they commit to being available to respond to that crisis at that time. So they're given a stipend, which is, incentive for them to be part of this because, there's feast and famine in crisis. And so anyway, I'm going to try to get more information on that. I think that is probably what Park County is going to ask for that funding. So those are two really good things, I think, that would support things we're already working on in the county rather than adding other things to our plate, but to make, some of the things we're doing sustainable, which is where my brain is going with this, is not to add more, but to create sustainability and continue the things that we have. So those are a couple ideas I have. I didn't see in this email any time frame on this, so I will probably reach out to Steve and see if I can get a little more information on this. But I was very interested in this when I got that email. And Mr. Doolittle and I have been talking back and forth about the homemaker program and the possibility of bringing that into Jefferson County to support some of our senior people. So he and I are kind of working on what that looks like, whether it's something we can do right now or whether it's something that we look at. I've completed a couple of the projects I'm working on. I have talked to Mara County, who does run this program through their public health department, and their director said that it's been a very valuable program for their county, but there is quite a bit of work on her end to keep it going, to manage the funding, to work with the hired people that they don't have to be clinical staff that do this. So I don't have to have nurses that do it, but there still has to be staff. And when she doesn't have a community health worker to do this work, then she needs to provide that support from her department. So it would take us, having some availability to care for those folks when there wasn't a worker to care for them. So it is something I'm interested in, and we're trying to seek more information on. And backtracking a little, speaking of community integrated health, I think that might be another place where we could maybe use some of those opioid funds, because I know RIN is always looking for funding to keep that going out on in Whitehall. So I'm gonna write that in my note under opioid. So sorry, swirling around here. That's kind of what I do. So I don't know if you've got any comments on that, but I think Commissioner Doolittle said he was going to reach out to that grant facilitator and try to get some
I got hold of them.
Yeah. So we are kind of looking at whether we could do that. We've got an aging population. I can think of several people right off the top of my head that would benefit from something like that. So it is something I'm interested in. I also saw an email going around about the master contract and took a look at that. And it is a lot different from what we've signed in the past. So some of the areas, there's a lot of things going on. The auditing was a concern for me. The IT was a concern for me. So I don't know if you want to have a bigger discussion about that, but I think there's some things we really have to look at and get some legal counsel on, because they're not things I'm comfortable with in that new contract. So.
As you could tell, it's going county to county and they're tearing it apart. So hopefully we'll get down to a product that's comfortable for all of us.
Yeah, well, I think we missed the option to report on it. I think it was end of April. But anyway, I think we need to have a voice in what's going on there, because I think it's a little bit scary what they've got in there.
Sure.
So I don't know when that master contract comes out that we have to sign, but I think we need to be looking at some of those things in it.
What kind of money is that attached to? Is that most of our funding for your program?
It's kind of all of our grants that come through the state. So maternal child immunization and FAP. So yeah, it's kind of attached to all that I'm doing in my department. So it makes me a little nervous.
Yeah, we'll keep an eye on that. I mean, if you want to print that out and just start highlighting it, we can get together with Steve, or you can just talk to Steve about it. And, I sent it to Steve and you yesterday with some of the crossouts that some of the other county attorneys did.
I will take a closer look at it, because it's a little anxiety producing to me what they've got in there.
I don't know how much leeway the state's going to give us. I have no idea.
This is the first time in my interim that I've had to sign a master.
Okay.
But it is different, because it was 2019 through 2026 for this one that we just had. So this is my first time to look at the master. Yeah. I will be out of town from May 14th through May 22nd or 3rd. My granddaughter's graduating out of state, so I'm going to celebrate with her just to brag, she has a full ride scholarship to the University of Utah, plus money in the bank from her other scholarships. So
Great.
I'm pretty proud of her. Yeah, so it's gonna be a big party. So I will be gone. Kana will also be gone during part of that time. So we're a little bit light on public health, so Jim might be our person
Okay.
that we need to rely on if something happens.
Craig's good about filling in too. He does for the road department a lot.
Okay,
Yeah.
and Craig.
Yep.
So Craig and Jim are having public health for help. I will have my phone, I will have my computer, I will be able to check in, I just be out of town.
Sounds good. We're talking about the purchase of the building next week, not this week,
I have it on my calendar to attend.
for next week.
Yeah,
Okay. We put it in the notice for this week and we didn't get it on the agenda quick enough, so we had to bump it a week.
yeah, I saw Helen's announcement, and so I do have it on my calendar to come next time.
Okay.
Are you gonna be back over at the?
Yeah.
Clerk?
Today's our last day.
Today's the last. And then I didn't know if there was any update on a sanitarium or not, but just wondering if we're looking to hire still.
You heard anything new on the sanitarium?
No. Nothing yet. I'm working on it.
All right, well, we're still plugging along, doing our thing. So far, I think it's working out okay. We're kind of ironing out the hitches. It does put, more stuff on Molly's plate, and was out last week, so that's why I was handling complaints and whatnot.
And every time I hear somebody asking about something about the sanitarium, they're really like, we really need a person in county for sanitarium. And we understand that. They go smoothly.
Sadly, there aren't many sanitariums. I think there's 42 in the state that are working, and the big counties have several of them. So if you figure there's, 60 jurisdictions that need a sanitarium with tribes, you don't have coverage. I
Right.
mean, we just don't. So
Yeah.
I think what we're doing is probably a fairly healthy way to handle it.
Best we can do with what we got right
Yeah.
now, so.
But
hopefully,
it's obviously not ideal.
yeah. We appreciate you picking that up and running with it. It's a whole lot of headaches, yeah.
Yeah.
Molly's doing a great job and.
It also falls on the rest of my staff, when Molly's out, we have a lot more foot traffic with environmental health in our office than we did before, so.
Yeah.
And a lot more phone calls. I think probably 2/3 of our phone calls are environmental health.
Really? Wow.
Yeah. Yeah, we haven't counted, but it seems like it's a bigger, so.
No, I'm assuming the old sanitarium number is getting pushed over to Molly's phone, is that right?
Yeah.
Okay. Somebody asked me that the other day. I'm like, I don't know. I'm assuming it's getting bumped over there.
Yeah, they're coming over, so.
Okay. Good.
All right.
Recently,
Anything
did
for me?
anybody ask you, about the sanitarium? Cause I had somebody call me, but I can't get a hold of them. Yeah, I mean, recently in the last 2 weeks, anybody calls your office, wanting to know anything about a county sanitarium? Or what's going on, like sort of what the question you asked?
Yeah, I had one person reach out to see if we were still hiring. But that was a little while ago, so I have.
She's very Scogan. Does that name ring a bell? Did he reach out to you guys?
No, that wasn't who reached out to me.
Okay.
Yeah.
Just I asked, cause I can't get a hold of them.
The contract sanitarium?
Well, I had a question. All he said is, I got a question for you. Give me a call. Call me at 7 tonight. And I tried calling him. He's out of where it's blocked. But you can't get a hold of him. Who? There's Scogan.
Oh, Scogan, okay. Not the sanitarium.
No, I wanted to know about it.
Oh, okay, gotcha.
Do you guys have the cards for the contractor so that you're able to refer?
Yep.
Yeah. They just gave us a new card that also includes Delilah's phone number, so we have a few of those. She is a sanitarian in training now, and Delilah was the one that came needing to get into the building the other day, so.
Most of the calls I get, they have been working on something and I don't know if it got caught in when Megan dropped off or what. But it's like, it's either stuck with Molly or it went to the sanitarium. Most of the time they got confused somewhere on our side, it's never made it to the sanitarian or didn't need to go to the sanitarian. So
Right.
it's just that transition we're doing right now where we gotta figure out how to dig up documents to be able to give to these people. And yeah,
Well, and I honestly, I mean, I get copied on a lot of the emails that are coming through between the sanitarian and Molly, or between Jim and Molly. So I have some idea of what's going on, but like when somebody walks in and says, I need this permit, you know, we're kind of clueless really.
Yeah.
So they're not getting the best customer service if Molly's not there. But
But you take a note, then Molly. will-
We are.
when she gets back, yeah.
and I had Molly, when she was gone last week, I just had her put on the voicemail that if this is an environmental health call, if you need to talk to a sanitarian, please call. And I had her put Van's number on there so that we were getting them directly to Van and not having to, you know, do a interim thing. And I think that worked a little better. At least on our end, don't know about for Van. but
Yeah,
it
well, if you
did
didn't
for
get a
us.
call back, you're good.
Yeah,
Good.
so.
Good.
So it eliminated some of that, but we still have the foot traffic, the walk in.
Yeah.
So,
We appreciate it
all
very
right,
much, so.
all right, we
You got a
have
card
really.
handy? And you
what-
got a card handy right now?
I don't have a card with me, but I could sure get you some.
Could you please?
And then, we've had two very successful, health fairs this last month. So we were at Jefferson High on the 15th, so just the high school kids and a lot of partners there. And like I said, this is an activity we do for our PICMA prevention activity, which is grant associated. And it's kind of inspired by some of the losses, fatalities that we've had the last few years with our kids. And so that's why we're bringing in these things to try to do prevention activity. Last year, when we did it in Whitehall, we did it 6 through 12 because that's how their administration divides the school. But we're asked to do K through 12 this year. So we did the littles, which made this nurse really happy to get to interact with littles. But it was a little bit different trying to, you know, have things that applied for a 6-year-old and an 18-year-old. But it was successful. Everybody was really happy with the outcomes on those. So they were good.
That's awesome.
Great community involvement.
Yeah.
I said to James, because he went to the Whitehall one, and I said, I don't think I saw your smile go off your face the whole day. He said, I really liked this. So that was good.
That's great.
All right.
Thank you,
so
Pam.
much.
Thank you.
Thanks.
Journey.
Adjourned, all right.